desensitization. So that's what we're going to be talking about. So I have some props here because that's what we're going to be going through. So basically, desensitization is getting your scar used to different textures just to help your brain recognize that all of those different textures and feelings are safe for your scar, that it's okay to touch your scar. Once it's fully healed, it's telling your brain it's okay. These sensations that you're feeling, it's all okay. So that's why we use different textures or different to produce different sensations so that your scar then can adjust to that and tell your brain that it's okay, so to feel these things. So we always start soft and move to progressively rough, more rough textures. So for example, the makeup brush, okay, so this is a good place to start. And then you're going to work your way up to more rough textures. So the goal with this is to do it for, a minute or two, maybe once a day, a couple times a day. But if you're somebody who maybe where your C-section scar is, maybe your pants irritated, or if you wear leggings or certain underwear irritates that scar, or maybe you aren't used to touching the scar and you're kind of, have this hypersensitivity. So maybe sometimes people experience a lot of pain with the scar, just touching the scar. So something that shouldn't really cause pain by lightly touching it, it does cause pain. So we need to retrain your brain that it's okay to touch that area. We need to touch that area. It's good for that scar. It's good to help it heal and help your body be able to recognize that once the scar is fully healed, we need to get it moving and we need to be able to touch it and have our pants go over it and all of those things in our daily life. So that's the goal with desensitization. So first of all, before you start this, if you haven't touched your scar, that's probably a good place to start before you add different textures. Is just you get comfortable feeling and looking at your scar, okay? So grab a mirror, just gently touch your scar. Some people have a really hard time with this, and that's completely normal. It's hard, you just went through a surgery, you've got a newborn, there's a lot going on with emotions and hormones, and all of those things can influence this as well. But just gently touch in the scar, and if you're not comfortable touching the actual scar, just touch the skin around it, just light touch, nothing crazy. And this is all, once it's healed, you don't, then you can touch over the scar, but you can start touching the area around the scar before it's fully healed. Just get used to the sensation in that area, okay? So for this demonstration, we're just gonna pretend that my C-section scar is my forearm here, and I'm just gonna show you how you might do this. So the first thing you would wanna start with is a makeup brush, and maybe you're just gonna do long strokes gently across and back, both directions. You can kind of do a gentle little brush, little smaller strokes across. You can do it, up and down. You can make circles along the scar, okay? So do whatever you feel just to kind of get used to it. And then, once you're comfortable with something soft, like a makeup brush, then you want to go to something that maybe is a little bit more rough in texture. So I have just like a cotton pad that you might use for your face here. So there's two sides for mine. Mine is really soft on one side and the other side has, some like ridges on it. So you could maybe start with the soft side and again, just rub up and down. Maybe you're gonna do up and down here, circles, all along that scar, okay? So you can just go in all directions, okay? Getting that scar used to that, then I might flip it over once I'm used to that. And I've done that for a day or two and things are improving. Sometimes it might take longer. You might spend a week on one, texture before you move on to the next one until your scar is comfortable with that and you're comfortable with that. So then I've done that. It's a little bit rough there. Then I might go to like a washcloth or wash rag that has kind of a rough texture. So you want to get that scar then used to more rough textures. Okay, you could also after this maybe do like a soft Velcro over that area. And again, we're just kind of going all along the scar and the skin around it too. Some people are sensitive in the skin just surrounding the scar as well. So go wherever you do feel those sensations, that sensitivity, and just get that scar used to feeling all of these different textures so that your brain can recognize that it's okay, so you don't have to be hypersensitive in that area. You can retrain your brain that it's okay, and that way you can go on with your daily life without worrying about which pants to wear or you can't wear this because it irritates your scar. So I hope this helps desensitize that scar and hopefully just get you a little bit more comfortable with touching the scar in that area.